When virtue and modesty enlighten her charms, the luster of a beautiful woman is brighter than the stars of heaven, and the influence of her power it is in vain to resist. Akhenaten, 1335 BCE. One woman, her world, and fertility's broken promise. In practical terms, fertility and how to improve it is hugely important to the individual woman. It's what keeps IVF clinics open. But at a more abstract level, it matters for entire populations too. Why? We humans had a pitiful population growth rate for thousands of years, less than 0.1% per year. Even now, the typical young couple in the best possible health can expect a monthly pregnancy rate of only around 20%. The 80% monthly failure rate shows that humans are not particularly effective at reproducing. Anyone who has stood in amazement watching a world population clock sees a very different story and knows that count is always changing. The numbers advance fast now thanks to declines in childhood mortality and whenever mothers have more kids. Of note, human life expectancy has been gaining 2 to 5 years each decade since around 1840. All this happens because babies are born, people migrate, and then we die. And to really understand all of these factors, someone needs to measure, or at least estimate, why some women have babies at a young age and some have no kids at all, why some people leave for lands far away to begin a new life while others stay in their hometown, and, of course, why some people die too soon and others reach a very old age. These factors have been in motion from the beginning, but here we will focus just on the first part, reproduction or fertility, and specifically how the ovary manages that portfolio. It comes as little comfort to patients having an unsuccessful IVF cycle that we now live in a time of decelerating human fertility. World population growth reached its peak, more than 2%, in the early 1960s, and has basically been in a free fall ever since. Our average fertility rate now hovers near 1.2%. This is expected to be zero by the year 2100, and then population growth for planet Earth will end. Technical snapshot. The steepest decline in births was among teens between age 15 and 19, where birth rate dropped 9%. Although teen births are still relatively high in USA compared to some other countries, it has fallen sharply in recent years. This is a trend attributed to greater abstinence and better access to contraception. That decline was slightly offset by more births among women aged 40 to 44, which increased 2%. Births in that older age group have been rising gradually since 1982, most likely due to wider use of more successful advanced reproductive treatments. This is a complex topic, and it's a big ask to portray any one research idea, like ovarian rejuvenation, as a meaningful remedy. But framing the scope of the fertility problem in a macro setting can help see how new corrections, while not comprehensive, can offer help to one patient at a time. But first, the problem and the suggested approach must be known and fairly appraised. While nobody books a fertility consult to hear a social studies lecture, some IVF clinics might not see the bigger picture. Does it matter? Well, if you're a patient or a loved one listening to this book, at least you have the actual data and can form an independent opinion. When the scope of fertility has been scaled against the world, we can next fix our measure to the individual patient. Yet the journey will draw even closer to explore the small but essential parts deep inside you, like an engine working quietly in the background. If the ovaries are to be rebooted or rejuvenated, they first must be appreciated and then understood.